Hello, I'm Darwin, and welcome to my Learn Hub. This is week 8 for Clinical Kinesiology Lab. That's PTA 210. So for this week, I am going to demonstrate how to palpate the gastrocnemius and the soleus muscle. Let's start with the gastrocnemius. So the gastrocnemius is located here, posterior to the leg. The origin of the gastrocnemius is at the medial and lateral posterior, medial and lateral condyle of the posterior side of the femur, which is right here. And it goes all the way down towards the calcaneus via the calcaneal tendon. Now the action of the gastrocnemius is the primary action of gastrocnemius is to for plantar flexion. So Valerie, do you mind pointing your toes down? And we can see here that the muscle is activated. You can see the belly, muscle belly right there, and it goes all the way down. It becomes tendinous as it reaches down to the calcaneus. Now you can go ahead and relax. So this is the bulk of the belly of the gastrocnemius muscle. Now the soleus muscle is the origin of the soleus muscle is at this area here called the soleus line, and at the proximal posterior side of the tibia and the posterior head of the fibula, and it goes all the way down towards the calcaneus via the calcaneal tendon. Now the action of the soleus muscle is for plantar flexion. So Valerie, let me ask you again to point your foot down. So here is the soleus muscle. It's actually wider compared to the gastrocnemius. It's right here. Now, go ahead and relax. So here's a technique to isolate the activation of the soleus muscle. Valerie, I'm going to ask you to bend your knee as far as you can. So in this position, I'm going to ask her to point her foot towards the ceiling, and that way, okay, let's do it again. Relax, go ahead and point your foot. So when she did that motion, I felt the contraction on this side of the muscle, which means it was activated. That's this part of the soleus muscle, and nothing was happening on the gastrocnemius. That means it was the soleus muscle that was activated. Now, to demonstrate how to shorten the soleus muscle is simply to do plantar flexion. That's shortening the soleus muscle, and to lengthen the soleus muscle is to do the opposite, which is dorsiflexion. Now we're lengthening it. Now, as for the gastrocnemius, one way of shortening the gastrocnemius is to flex the knee and do plantar flexion. That's shortened. Now to lengthen it, we'll do the opposite. Extend the knee and then do dorsiflexion. That way, the muscle is lengthened. And that's the gastrocnemius and the soleus muscle.